My name is Dr. Muhammad Zakaria Mukhtar from Murtala Muhammad Specialist Hospital. I expect this training to provide skills optimization, provide updates on the management and going on with the problems of sickle cell, because sickle cell disease is really a hard disease to treat and manage. So thank you to Sickle Cell Foundation Nigeria.
I'm hopeful that the training today will significantly increase the capacity of healthcare workers, from doctors to nurses, to community health extension workers, in the management of sickle cell disease patients, from prevention to diagnosis to treatment and the management of complications. And I'm grateful to be part of this event, and I hope I will contribute positively to the success of this event, all in all. Thank you very much.
My name is Sadia Abdul Karim. I'm a nurse, a pediatric nurse from the Pediatric Sickle Cell Clinic, and also the matron in charge in the Pediatric Sickle Cell Clinic. I would love to say, if there is anything that I decided to take home today and to apply it in my clinical practices, apart from the knowledge, is the experiences that other colleagues have shared from day to day, particularly when it comes to the psychosocial relationship and the empathy when it comes to the mothers. We now, from today, we realize that it's not just only the patients that took the pain, but also the mothers that also took the pain with them. So when you are treating a patient with all the empathy and sympathy and care and kindness, you should also take along the mothers.
Today, I learned so many things, how to take care of the sickle cell patient and how to manage the sickle cell patients. I learned about the stroke prevention and how to detect stroke early and how to detect even the sickle cell patients.
My name is Dr. Selma Ali Swed. I'm a consultant pediatric endocrinologist, and I'm also the head of department of Murtala Muhammad Specialist Hospital. Kano State has the highest number of sickle cell disease in Nigeria, and Nigeria has the highest number of sickle cell patients in the world. This is to improve capacity building in terms of management and also in terms of their ability to also be able to identify patients that have complications, either acute complications and also chronic complications with regards to sickle cell disease.
We hope by the end of this training program, the participant will be able to understand what sickle cell disease is, the global burden of sickle cell disease, and how it affects Nigeria as one of the countries with the highest burden of sickle cell disease.
Hi, my name is Halima Usman Abdurrahman. I am a public health intern. I greatly appreciate this program because I got to learn more about the sickle cell and more preventive measures, and it's going to help me more in my public health journey.
One of the objectives I have learned is how to diagnose a patient with the sickle cell disease and how to manage the patients according to the primary healthcare guidelines.
We aim to ensure that more people are screened, and all the screened people or people found positive were enrolled onto care, were receiving care properly and with prompt care actually at both primary health care and also at facility.
With this training, we hope that our participants will be able to manage their patient with sickle cell disease better, especially in terms of diagnosis, recognition of danger signs, pain management, and of course, growth monitoring and nutrition. So it is our hope that even at the primary healthcare level, our healthcare workers will be able to evaluate our patient with sickle cell disease, recognize those that have serious condition or urgent conditions, and they should be able to appropriately refer them to the tertiary or secondary health facilities where they can get appropriate treatment.
I'm Dr. Annette Akinshete. I'm the National Director and CEO of Sickle Cell Foundation Nigeria. The training itself was not from out of the blue. We actually went to the basics. We went to the source. And the reason the Federal Ministry of Health developed a policy guideline for management of sickle cell in Nigeria is that we can support them to cascade it down. And I think this is what we're doing here. It's probably one of the first times we're testing out these guidelines. I was part of the development of the guidelines where everybody's brought together and we sit, we brainstorm and agree on how these guidelines should look at every level, from primary, I'll say from primary across to the tertiary and quaternary level of care. And we had excellent facilitators, excellent resource persons who knew so much. A lot of experience has gone into, they're talking not from the books, but from what they've seen. There's nothing like that. You can't replace that. So those who have seen it, they've almost lived it the patients and them. I tell you, as a healthcare worker, you take on what your patients bring to you. So they've kind of lived it. So the modules are prevention, apart from introduction, prevention, treatment of complications, acute complications, the ones that happen suddenly, the chronic ones, the ones that develop over time. That in the end, we're beginning to see more and more in older persons. It was good that they brought this to the fore and to their attention so they could see for themselves. I'm talking of the healthcare workers now, to see these things we come across. Indeed, we can tackle them. And to be in this kind of forum where they can see the resource persons, the facilitators. Some of them are professors where they work, engaging together, it makes a difference. And like I said, we're going to carry on beyond this forum and have them continue to engage with these resource persons. So if they had questions or they had comments or had any experiences to share, they've continued to share beyond this space.